For this lecture, we're going to talk a little bit more about the psychological nature of our patients and what that means for how we are to proceed with patient care. While it's important to understand the psychological nature of our patients, it's equally important to understand what signals that we're giving off. Are we giving off those warning lights that are indicating we're too busy, we don't have enough time to be able to answer those questions? Those nonverbals give away some of those clues, but it's important for ourselves to understand, our own psychological demands. It helps us to work through those difficult situations, those difficult patients, to make sure that we are, in fact, not projecting those busy signals to our patients, but we're demonstrating that we have enough time for them to view their needs in more of a holistic approach. So I've mentioned this several times, but it's really, really important to not be solely task-oriented, but to make sure that we are focusing on the tasks and the care that we're providing to our patients. In terms of psychology, the textbook describes three different ways of thinking as far as how someone's personal behaviors are shaped. As we're going through each of these three ways, I want you to kind of dissect what is your perspective as far as how someone's behavior is shaped. I think I guess my perspective is that it could be made up of a combination of different factors, but some of them are quite interesting. So, by the end of kind of covering these three, I want you to make a decision about what your opinion is as far as where someone's personal psychology actually is derived from. The psychodynamic approach is based on unconscious processes that take place because of events that we've experienced. So those events all play an individual role in how we behave, how we rationalize, how we make decisions. And they're applied forward in a semi-unconscious nature, at least at the entry level. Kind of as we proceed through different levels, our ability to rationalize does take place, but it's about the experiences that we've had that shape our own personal philosophies. So there are different levels, three different levels. The id level is basically what happens as you're young. It's as you grow older, each action that we take place is going to somehow shape our personalities. It's once we reach the ego phase that our reasoning starts to take place. So now you start to rationalize right from wrong. We consider our actions before applying our actions. So it's not, truly this unconscious projection any longer, but it's still shaped on those unconscious projections, those experiences that we've gone through. The superego phase is kind of like the overarching personal philosophies that we develop that help drive our beliefs, our morals, essentially our foundational values that govern us forward. So the superego portion is kind of like the advanced level. So you can kind of think about this as like level 1, level 2, and level 3. Another frame of thinking is the behavior approach. So says that our approach focuses on learned behaviors. The more we do something, the more we understand something, the more reinforced those actions become. Especially when you're kind of young and there's a reward at the end of the tunnel for something that you do. There's a you're more likely to complete that type of thing. So those actions create reinforcements that we do carry forward. Where this is really important in healthcare, if you believe this type of approach, so in the hospital environment, if you have one bad experience as a child, each time you enter that hospital environment, you may believe the experience is going to be bad in the future. Same thing, a dentist's office, doctor's office, whatever the case may be, if a bad experience happens, that energy is channeled forward each time that you do it. So it is important to make every experience a positive experience, regardless if you believe this frame of thought or not. But it's pretty interesting. And, I can see myself understanding ideas of that psychodynamic approach and understanding ideas of the behavioral approach. And that's kind of why my personal feeling is it's a more of a fusion as far as how an individual's psychology is established and phrased. I think it's certainly a combination of instinctual factors and learned factors. Now, the third school of thought is the humanistic approach, and it more functions on the person in the moment, at the now. So, different situations will function to change that out at the now type of perspective, which may help to demonstrate, different levels of respect, empathy, openness, and trust. Ultimately, this is going to help phrase how a person outwardly projects themselves in the moment. So, and I can kind of buy into a little bit of that too, of course. So as we consider those underlying beliefs and foundational areas, whichever dimension you believe is perfectly cool. But everyone's outward experiences, outward projections are going to change based on their individual situations. And with healthcare, the patient is coming to us in some type of altered state at times. Maybe it's just anxiety, maybe it's stress, maybe it's depression, maybe it's a traumatic illness. There's all kinds of different factors that may change how an individual perceives a certain situation. The definition of stress is any situation that we perceive that we do not have the ability to cope with. That's interesting. When we think of, I think when you think of it like this, I think the term stress may be a little bit overused, or maybe it's one of these things that we have to just have more self-belief that we can cope with different things. It's important to maintain stress levels. Stressors are unique from person to person. My stressors may be different than your stressors. They likely are. There's likely some overlap between person to person, but every person is unique. Everyone's coping mechanism is going to be unique as well. But it's important to control and find those coping mechanisms. So, when things get busy, when life gets tough, it's definitely important to be able to deal with that, because stress can lead to other things, including anxiety and depression. So when you start to look at these different terms, there is a lot of overlap, but they are defined by our textbook as being different terms. Stress is defined as being short-lived, anxiety as being present for at least 6 months or longer, and then depression is a unique term that doesn't have a timeline associated with it, but it makes up it takes on some of those stress and anxiety based symptoms, if you would. So the healthcare environment itself can bring on some of these symptoms, and these symptoms, as defined by the textbook, may be brought about by new situations, presence of individuals that they may not know, concerns about appearance, or doing things that may be considered socially inappropriate. So when you think about, any given situation, we'll say, you're going to a new doctor for the first time. So not only are you going, to a new facility to see that doctor, but you're interacting with people and healthcare providers that you really may or may not know. Maybe you just had a recent mastectomy and it makes you feel uncomfortable. Maybe you had some type of traumatic fracture that makes you feel uncomfortable. So, different types of things can lead to different feelings of uncomfortableness. And just simply by asking the patient to put on a gown and walk from, point A to point B, can be considered inappropriate to some individuals. It can create some stressors. So all of the combination of all of these, factors of newness can certainly lead to a flawed outward projections by those patients. They may be projecting themselves differently than they normally would in a given situation because of all of this newness. So as such, their coping skills may be diminished. They may be a lot more emotional than logical as far as their behaviors. So it's always important to respect our patients regardless of their outward responses, because those outward responses may not be directed to you. They may just be in regards to the personal feelings that they're feeling. So understanding the psychology behind the patient and what's leading to these stressors can be important as we're providing our care for our patients. Now, what we don't want to happen is for someone's outward emotions to truly spill into anger and aggression. One reason why this can spill over is because of a lack of perceived information being provided. So it's important to be forthcoming to our patients as far as what we're actually providing. Helps the patient regain a sense of control and a sense of power. So give the patient the information necessary to make important decisions, provide it, in simple terms, allow the patient to have the opportunity to ask questions and get answers. So I think all of those things are important to help reduce, but the patient is going to have some type of, potentially could have some clouded judgment based on the illness that they present with, the amount of pain that they're in, the type and the amount of medications that they're on can alter. So it's important to try to, control what we can control and reduce what we can reduce. And if we can reduce any intentional or avoidable events that could escalate any form of anger, we need to do so. So, aggression can take place, just the same, lost sense of power, lost sense of control, and trying to regain that, or simply by the patient is embarrassed of this or that, and they're trying to hide those feelings, and that's how it's being outwardly projected. So it's important to not fight anger with anger, so we have to remain calm, and by listening and providing answers and details that can help to de-escalate any situations that may arise. So keep that in mind. So now we may be doing like this awesome, amazing job at giving the patient the information, and you're like, why isn't this patient doing what I want him to do? And we call that non-compliance, and compliance is an important factor to try to obtain, because there are some negative ramifications that can come about because of lack of compliance. It slows down the whole schedule, and when you slow down the schedule, the patient may have a 20-minute slot, and they exceed that 20-minute slot. What does that do? It slows down the next patient and the next patient and the next patient. Instead of each patient being there for that 20 minutes, they're there now for 2.5 hours, creating some frustration, creates ramifications to patient satisfaction. It also creates issues with budgetary issues. So say, one missed appointment in an exam in a modality like MRI can wreak financial havoc. So, we have to make sure that we are maintaining our schedules for that being one of the potential reasons. Radiation concerns, if a patient has to have repeat studies because they didn't follow the proper prep, that can create problems. Tissue damage and radiation therapy can happen because of lack of prep, lack of instructions, lack of follow through, lack of compliance. But it's important to make sure that we don't outwardly express, oh my gosh, this is so annoying, why aren't they doing what I want them to do? And that's typically the perspective that we take on. Now, the textbook doesn't mention the idea of adherence, but it's one that I want to bring forward because the ideas of compliance and adherence are very, very different. So it's no longer about why aren't they doing what I want them to do. We have to get the patient on board to develop a partnership, and a partnership centers with the term adherence, whereas compliance is more of this is what I want you to do, this is how I want you to do it, this is when I want you to do it, and there is no why. It's just this is what I want. If we can gain a partnership, the chances of us gaining patient buy-in substantially rises. And when you think about some of these types of things, when you think about them following prep procedures, for example, that if we can get them on board, get them understanding why these things are important, create action plans for them to follow, that they're willing to follow, is important to make sure that we're not experiencing these wait time issues. We're not experiencing these budgetary issues, radiation exposure issues. So it's important to create a model of adherence rather than a forced idea of compliance. So kind of keep that in mind. It's just a slight change in perspective. The textbook cites a variety of different reasons why there can be issues with Compliance, I think if we just switch our perspective, create an adherence model, a shared decision-making model, that can help. But here are some reasons. Maybe the treatment itself, what we're asking the patient to do, is just confusing. Maybe there's too many things going on. Maybe it's creating side effects. It doesn't make them feel good. They don't like, what's actually going on. Maybe we're not doing a good job at being thorough and explaining how to do this or that. Maybe we're not talking at a level that a patient is understanding. Maybe we just need reinforcements. Maybe we need information for the patient to be able to take home with them to understand. Maybe the medication is doing a great job and they think, oh my gosh, I don't need it anymore. So you can see there's all kinds of issues here. I think that one of the biggest ones I will say is probably required lifestyle changes. Anything that requires a lifestyle change is going to be difficult for the patient to buy into. No matter why they need to make that lifestyle change, it is difficult to give up and to make forced adjustments. Smoking compliance is one of those ideas. Diabetic compliance is another. So anytime you have to make a forced lifestyle change, it is difficult to get buy-in. So that adherence model, nonetheless, I think will help substantially. So one that I hope you're in better understanding of now the differences between compliance and adherence. Now, the final piece of the psychology in healthcare centers around dying and bereavement. Really a game changer because it really can alter how a person is behaving within the healthcare setting. So, they may be fine with it in a normal situation, but because they're going through what they're going through, or a family member is going through what they're going through, it can really amplify certain situations. So it's important to remain calm. It's important to be there for the patient, not to take offense to anything that's said at any point. Kubler-Ross stages of grieving are indicated here. I think it's really important just to kind of reflect. I'm sure you've probably seen these stages before, but every patient proceeds through these stages differently when there's some type of dramatic type of illness that they're going through, an individual is going through. So first off is, to believe that essentially there is no problem. Whatever, this is fine. I don't believe that it's an issue. When it starts to, when you start to buy into it and understand that, oh my gosh, this is real, typically the next emotion that's stimulated is that anger. So, it can be a difficult time to work with that patient because they are completely unhappy, and really, unhappy, I guess, is an understatement. They are, fueled with rage at time about why this could happen to them. Those emotions will eventually subside, and then some bargaining takes place. Basically, it's like, what if I do this instead of that? It'll be okay. So this is kind of like a de-escalated phase. This is an escalated phase. This is a de-escalating phase, and this is just so downward de-escalating that it can also create substantial issues for that patient. Depression is a serious types of thing that often requires some type of intervention. And since we're focusing on the psychological aspects of things, depression is something that, as healthcare providers, we should recognize. Final stage is bringing it back up a little bit, is the acceptance. And hopefully it's a well received acceptance. Definitely difficult. Every patient will proceed through these different levels at different points, and just because you reach bargaining doesn't mean you're not going to go and revert back to anger. So I think it's kind of a fluid-based cycle as far as the different stages, but it's important to recognize these things and understand that the patient is going through a lot, and it is our job to provide some stability for them and to not to not judge and to make sure that we're there and providing the care that's required of us. Now, this concludes our psychological topics, so hopefully you can take a few of these pieces forward and really go to bat for our patients, try to understand our patients a little bit more, and become a little bit more patient-centered.